Good afternoon. This is Doug Farquhar. I direct government affairs for the National Environmental Health Association, and this is the July edition of Advocacy Insights. Today, we have three special guests with us to talk about their legislative sessions that have recently come to the conclusion, at least in Illinois and Texas. In California, you're going to be dealing with this, the legislature for at least the next year. But we have Chris Sparks with the Houston Health Department, Justin Dwyer from Peoria City County Health, and Amanda Bloom, who is with the California Conference of Directors of Environmental Health. To begin with, I'm going to ask everybody to kind of give us a brief overview. Tell us about your legislature, what is it like working for them, and some of the unique aspects of the legislature. So, Chris, do you want to give us an overview of Texas?
Absolutely. Texas is Republican dominated legislature. It is a little tough to be able to deal with the legislature because the legislature only meets for 5 months every other year, beginning in January, ending at the end of May of every odd year. And the thing that about dealing with that legislature is that it's hard to be able to give review of bills and work with them to be able to get changes, especially if they're moving and they're continuing to change quickly. There's very little oversight or review by stakeholders. So a lot of times there's problems with some of the bills and what is in those bills.
Gotcha.
Yeah.
Well, Amanda, you kind of have the opposite problem. You have a state that's just as large as Texas, has pretty much the same population. California has the #1 population. Texas has the second highest population. And your Senate districts in both Texas and California are larger than congressional districts. But you have a legislature that meets all the time and it's dominated by Democrats. Plus, you have term limits. How does that affect environmental health policy?
Sure. We meet also in 2-year sessions. Right now, we're in the first year of the new 2-year session, which is the time when most bills are introduced. The other thing that's unique about California, well, we have not only are we dominant, we have a supermajority of Democrats, and we also have obviously a Democratic governor, and the governor controls the budget purse strings as well. So often policy efforts they can pass through the legislature, but then be basically killed by the governor by withholding funds. Also, I would say the supermajority also to some degree tamps down debate to some degree. There's not a lot of opposition. People bring forward bills, and to some degree, I think, members kind of move along each other's bills. And so that can be really great if you're trying to put a bill forward, but it can be very challenging if you're trying to kill a bill or amend a bill.
Gotcha. Justin, you're kind of in between these two in the sense that you've got a smaller state, but you got a real unique situation. You have a Chicago, which dominates the population base, but then you got the rest of the state that has to deal with Chicago. How do you deal with this bifurcated situation in Illinois?
It can be really interesting. Most of our governors have been Democrats. A lot of Chicago is a Democratic city. And then also, when you start going downstate out of heavier population areas outside of, Peoria and some of the larger populations down south, it's pretty heavy Republican. So they definitely, have their say, but unfortunately, in some situations, it can be very lopsided, and some groups don't feel like they're being heard or represented.
Yeah. So how does that affect environmental health in your state? What are some of the biggest challenges in trying to get a bill or even improve a bill in the state that has such a strong dominance from Chicago, which is going to have one view of environmental health versus downstate?
So a lot of it comes down to funding and sometimes unfunded mandates that we run into. So, Chicagoland, gets a lot of funding, tax base, and revenue, whereas you go down to southern Illinois areas, their environmental health may be a single person doing absolutely everything for an entire county, simply because the funding just isn't there. And that's one of the challenges that downstate has a lot.
So they're really suffering from resource
Yes.
challenges.
Yes.
Chris, what do you think? How does the makeup of the legislature in Texas help hinder environmental health?
Well, Texas is very much rural dominated with a few large democratic cities. Your few large democratic cities do have a lot of population, but a lot of the decisions that are made by rural area legislators who are in a Republican dominated state. So a lot of the decisions that may be made are with the mindset of what's going on in a rural area, and maybe not always what's taking place in the larger areas of the state. So there's kind of a flip from what's going on in Illinois, where you have maybe the decisions of Chicago dominating the state, where you have in Texas a lot of the rural areas make a lot of the decisions about how environmental health laws go forward.
So do you see some conflicts with policies that you'd like to do in Houston that may get thwarted by the rest of the state?
Well, with one of the Senate bills that just recently passed, there was a move to move your mobile food units. They were handled by the jurisdictions, where it's now moved to the state to take over all mobile food units. And that was a part of a push from the rural areas to want the opportunity to be able to move statewide, where your larger jurisdictions want control of that, especially since you have higher populations and there's more risk associated with the food that may be served by those.
Understood. Amanda, you have a whole different situation there in California. Year round, you have all year to oppose things, but you have to deal with the situation of a majority Democratic legislature. How does that impact environmental health?
Well, yeah, like I mentioned earlier, I think it can be very helpful. For instance, right now we're moving a couple of environmental health bills that are sponsored by our organization, and they're moving through very easily. So they can move through on consent. There's not a lot of debate on them. The other side of it is we have a number of bills that we're dealing with this year that are frankly quite damaging to environmental health. And because they're sponsored by strong Democratic members, it can be very difficult to make changes or to kill those particular bills. So I guess the other thing I would add is, to some degree, we have the same challenge with the rural-urban mix. Obviously, we have really large population centers like Los Angeles, which is a country in and of itself. But we also have really small rural communities, with thousands of people in them, very small. And so both as an organization and then as we're looking, at the impact of environmental health legislation, we really have to take into account what does it mean for rural communities as well as urban communities. And in some cases, that means really thinking about extra support for our rural communities because, quite frankly, they just don't have the industry base or the fee base to support really comprehensive environmental health programs. And so particularly when it comes to hazardous waste management, it's one of the areas where our state has stepped in to provide some additional funding for those rural communities.
So what do you really think is going to be your biggest challenge out there regarding environmental health? I identified a few things. Texas Senate Bill 1008 that gave more authority to the state to regulate food services. Illinois, 1950, the Senate Bill 1950, Sanitary Food Preparation Act. California, we have AB 1288, which deals with the REHS. So, Chris, what are some of those food safety, environmental health challenges that really came up this year?
The more of your food freedom with cottage food and the expansion of cottage food in the state of Texas. One bill previously there was a clear definition of what was cottage food. Only these things. Well, the new bill that passed this year now says what cottage food is not. And it's only 5 items that are on that, 5 or 6 items that are on that list, such as dairy and meat, that are not cottage food. So it expanded it, the items that can be considered cottage food, extensively. And that's going to be a challenge for environmental health to be able to provide a protection to the public for that.
And you got quite an extensive cottage food law. There's a lot. It's a big regulatory gap, isn't it, in the state of Texas?
Absolutely, because there are no inspections and there's no regulation. It allows for cottage food to be sold anywhere, and under certain restrictions with the type of vendors that connect with your cottage food production operations. But it did expand where it can be sold and what can be sold as cottage food.
Amanda, you don't have technically food freedom, but you do have micro enterprise kitchens. One aspect of it I found really interesting is that the kitchen does need to be inspected once, but after that, you can have all sorts of sick kids, dogs, rats running around. You want to give us a little bit of insight about how that has moved forward in the state?
Yeah, we've had what are called micro enterprise home kitchens here for a number of years. There was actually some state funding that was also allocated to kind of get these micro enterprises off the ground at the local level. It is optional for jurisdictions to participate. So we have some that have really, taken it on and, are having, a good experience with it. And then there's obviously other jurisdictions that are really, it's not something that they're interested in participating in. But yeah, I think it's a continuation of, I don't know if it's food freedom or kind of what it is, but this really, there's a lot of interest among the public and legislators about getting food from new and interesting places. And those new and interesting places, from an environmental health perspective, sometimes can come with a fair amount of risk, and certainly something that's an ongoing conversation locally. For us, it really centers around street vendors, which are supposed to be permitted, but most of them are not. And we're really seeing many of our communities kind of overrun by people setting up unpermitted tents and a grill and lemonade and just serving up food to the public, which it could really be a recipe for a disaster.
And Justin, you're facing, you got the mobile food freedom bill that was enacted this year. How is your state handling the food freedom movement?
So Illinois, I guess we're lucky. We have a good seat at the table. And we work together with the organizations that want to bring and move food freedom forward. I know one of the bills that we had was called the food truck freedom, which basically you get licensed in one county and you can go wherever you want to go and operate wherever you want to go. And I know we had a lot of public health concerns with that one. Illinois is a very long state, say Texas, California, not as bad as you guys. Top to bottom is about 6 hours. But if you think of, a truck that's operating out of Chicago and they're going to go all the way down to, Springfield or past, where's the commissary? Where are they pulling the food? Where are they getting fresh water? Where are they dumping their sewage? And then they kind of took away some of the abilities for us to do fee charge inspections. So once again, if you want to inspect, what happens? Well, the county, the tax base is going to have to pay for that, instead of the mobile truck itself. So, but the bill didn't move forward this year. We're going to continue to watch. Figure maybe next year, we'll probably see it again, but we'll go from there.
And other things that are coming out there. We were just chatting when we chatted yesterday. NEHA, Make America Healthy Again. That's putting dramatic changes out there on not only processed food, but dyes and other products that can go in. We and what's so interesting is, yes, we expect these things in California, not expecting them in Illinois and Texas, but that's where they're happening. What can you say about some of these bans that are being introduced on red dye and vegetable oils and sesame oil? Is this going to be actually make the public healthy?
I can't speak from a nutrition point of view. I think what's going to be interesting is a lot of these bills are more going to be on the manufacturer side instead of the retail side. And it's the products coming in. Although I'm sure there are some that might be using some of the different dyes or things like that. So I don't know where that's going to fall on retail side. But I know this is where we're looking at the second round that the bill came up. It came up last year. It gained a lot of traction. I thought it was going to pass, and then it kind of fizzled out. It came up again this year, and it's kind of moving forward, but it didn't make it through session. So I guess we're going to watch and see if it comes back up during veto session, or if we'll just see it again next year.
And Chris, you had a really interesting one. Senate Bill 25. That was by Senator Colquitt. It puts Texas in a very unique position of requiring warning labels on all these products that talks about harmful chemicals, which is going to change the nation. It's going to be like California proposition that required cancer labels on everything. Texas is not used to being in the center of the warning label movement.
Yeah, there's been a push with for people who want to eat healthier. Mm-hmm. So what we ended up seeing is that there was a call for some regulation of what is going to be in the food. Mm-hmm. And Texas moved to the forefront of that with the passage of the bill. But one of the things about it is that when you talk about consumers' expectations of knowing what it is that's in the food, and then understanding that if we do that and there's deregulation mm-hmm. of a lot of those items, we have to be able to educate and be able to bring together evidence-based understanding of what's happened on the environmental health side and educating people about what they're expecting as far as deregulation of these food items. Now, when we talk about the labeling, a lot of that will probably fall on the manufacturing side of responsibility to ensure that gets done. It'll be tough to handle it on the retail side, so we hope to be able to work with manufacturing from the environmental health retail side to be able to ensure that gets done at that level.
And I'm going to toss over to Amanda in just a moment, but I want to put a little segue in there of something you mentioned yesterday about different products being labeled as catfish or other products when, a Chilean sea bass when it's actually carp or something along those lines. You see a lot of that out there?
There's a lot of it going on. And one of the examples that we kind of talked about was swai being labeled as catfish. It's happened, it's going on a lot simply because, the swai can be purchased cheaper. Mm-hmm. And if they can pass it off as such and consumers are not aware, and we need to do better on the environmental health inspection level to help to bring that to the forefront and so that it stops happening. And Justin had a phenomenal presentation here at NEHA on that brought awareness to environmental health professionals about looking for that in their jurisdiction.
Obviously, that's a segue over to Justin. Food fraud. It's very common out there.
Yep. And there's a lot of different types of food fraud. It's basically just misrepresenting food. Most of the time, it's for economic gain. The two big ones we've been finding in our jurisdiction is actually for sushi fish. If you're ordering red snapper, there's a good chance that it's tilapia. And if you're ordering white tuna, there's a good chance that it's actually escalar or oil fish, which is actually banned in several countries because it can make people sick. Because
This
it's
is
so
non-sushi, non-cooked.
And yeah, these are raw products, but they still are meeting the freezing process requirements under the FDA code. But at the same time, it's misrepresenting. If you think you're ordering, red snapper and you're getting tilapia, but you're paying the price of red snapper.
Yeah, Amanda, you were just mentioning you have a MAHA bill there, AB 1264. Is that going to be identifying certain things that are going to be prohibitive, or is it a little bit more deep than that?
Yeah, so what it looks like it's seeking to do is create a definition for something they're calling ultra processed foods. And they're actually going to be charging our Office of Environmental Health Hazard Assessment with adopting regulations and kind of figuring out which of these foods is hazardous, and then requiring schools to phase out the sale of these foods. So it's interesting because it's interesting that they've placed it kind of within environmental health hazard and not within kind of the broader chronic disease prevention part of public health, or even the Department of Education, which oversees school food sales. So it's a little bit of a different route, which is interesting. And I think the comments about consumer awareness are really interesting because we're dealing with a couple of menu labeling bills here. One would require allergen labeling on menus, and the other would require fast food restaurants to offer a children's meal that meets certain nutritional requirements. And the conversation we've been having from kind of a local environmental health perspective is, what can we verify and what can't we verify? We don't have the resources or the skill or the time, to verify that, for instance, the children's meals actually meet this long list of nutritional requirements. And to some degree, it's true with allergens as well. I mean, we certainly can, as part of our inspections, look for, safe allergen control practices. But, if there's somehow the public thinks that when a restaurant passes inspection, that information is somehow that's a stamp of approval or accuracy on that information that's being provided by food establishments, this is not quite accurate. And so, I think we're really wrestling with what does that mean, and really trying to educate folks in the legislature about, what does a food inspection, a restaurant inspection entail, and what can we do and what can we not do, and then what does that mean for consumers, particularly when it comes to something like major allergens, because you want them to be able to trust that when the menu says there's no sesame in the products, then in fact there's no sesame in the products. So yeah, I think it raises interesting questions for us, because I think as part of the bigger public health community, I think we're interested in helping the public make healthier food choices. But at the same time, logistically, what that means is somewhat challenging.
Yeah. And the California legislature did something really intelligent. I know not people have never put those two words together, California legislature and intelligence. But a number of years ago, when they started looking at chemical safety, instead of trying to come up with definitions themselves and trying to figure it out themselves, they created a program within the Department of Health, using the lab and using some other things to have the professionals kind of come up with it, with the standards. And actually, by going that direction, it gained such respect that the Congress, it honestly, after 40 years, it put pressure on Congress to reform the Toxic Substances Control Act. They really did something intelligent there. Do you see the same opportunities here for the California legislature, instead of saying this is what ultra processed food should be, or this is what should be banned, rather give the authority down to the Department of Health to say this is how we should regulate these issues?
Yeah, it's an interesting question. Yeah, I don't know that I have an answer to that. Other than, yeah, I think obviously the degree to which we can put this kind of decision making in the hands of scientists is better than trying to write it into code, because we also know that things change over time, right? So, I think it definitely makes sense that there's a partnership between the legislature and our state departments, kind of trying to figure out some appropriate guidance for local communities.
Gotcha.
And, I think, we have a long history of that, with other types of, EPA issues and, kind of broader environmental health issues. So, I think we do have the opportunity to maybe set some standards for other folks to look at and figure out whether they want to adopt them as well.
And Chris, you had a bill this year, House Bill 26, offers nutrition support under Medicaid. Again, kind of under the MAHA movement. Do you find does it make it challenging for the legislature to really work with the state because their sessions are so short? How are they able to put that together, some of these big issues together, really without relying on expert insight?
I think that we're able to provide some expertise, but some of that expertise comes directly from the state agency. Mm-hmm. And your local jurisdictions are really sometimes limited at the opportunity to be able to have impact by providing some information or review of that particular legislation and changes that may make the bill better, simply because of the how long the legislative session is. It's so short, and a lot of those bills have to move quickly. Mm-hmm. And if you want to get it passed by the end of the short legislative session, a lot of times the opportunity is limited to be able to do so. So it does make it hard. Yeah.
And one of the things that's often commented here is how profound environmental health is locally, how it's a local issue. And when they pass things at the state level that are uninformed, you simply have to take it, don't you? You have to figure out how to manage that bill.
You do. And a great example is with Senate Bill 1008, which challenges home rule. Mm-hmm. And requires jurisdictions, well, not requires, but it says that jurisdictions should use state law only to be able to enforce food safety laws. And the challenge behind that is there are a lot of novel food safety issues in certain jurisdictions that require you to be able to have an ordinance or something to be able to deal with that particular issue. And it challenges the ability to be able to do that, because there could be penalties from a business that it has a law that you enforced as an ordinance that was above and beyond state law. So it challenges our ability to be able to do it. We'd have to follow this uniform law and lose that novel item that maybe cause a problem just in your jurisdiction.
Gotcha. So you lose the ability to make those unique decisions that yes. are special for your jurisdiction. Justin, one of the foremost things that I heard from state legislators was, I have this bill. I want to do this thing. And I want to talk to the people on the ground. I want to talk to Justin. I want to talk to Chris. And I get the legislative liaison from the Department of Health who really doesn't know this. Is there a way in Illinois that you've been able to cut through the chatter to be able to work with the Department of Health and really get your word in front of the legislature?
So I know, we've had meetings. I'll bring an example. The last change of Cottage Food Act, the Home Market Act we had. There were some adjustments that needed to be made. We have two county health departments that there's two counties without health departments. And our law requires them to register in the county you reside in. Well, if you don't have a health department to register, how do you do it? So the issue that came into play was actually we made some adjustments in the law, and basically the county that doesn't have a health department has to create an MOU with the county, like a neighboring county, to register. So we opened up, we did the calls, we negotiated out. There were things we were asking for, some extra food safety measures in there, things we had already agreed to in our guides and stuff like that. We put in the law. The legislature, the representative that was pushing the bill really heavy was on the call with us. So the nice thing is we've all been kind of coming to the table. We have conversations, we work it out, we negotiate it. Then when it goes to the floor, everyone is at least for the most part agreed to what it is, and then we don't have a big fight when now it's on the floor.
And Amanda, let's close this out. What do you think are the biggest challenges coming before you regarding environmental health and the legislature? And then also, what are the most promising things going on out there?
Yeah, I said yesterday when we talked that I think in a lot of ways we're a victim of our own success, meaning that, our food safety laws in particular are, they're very effective. And when the public goes out to eat, they don't think twice for the most part about whether, they're going to get a safe meal. They really take that for granted. And that means that in some ways, I think food safety regulations are a bit hidden. And so it's hard for legislators and even the public to really understand how we have a really important scaffold around food that keeps them safe. And so there's a tendency, I think, to think they can just chip away at some of that scaffolding and everything will stay fine. And that makes it really difficult for us to kind of articulate why chipping away at the scaffolding actually, you can do that for a while before the whole thing collapses. And so I think we're seeing here in California kind of a chipping away to some degree of that, and that's worrying to us. On the other hand, we have some other things that are great for environmental health. We are moving through a bill that hopefully will bring more college students, college graduates into the environmental health profession. We're really looking at modernizing our registration code here in California. That's really exciting for us, really exciting for folks in the field. And so, yeah, as with anything, there's really great things that keep us going, and then other things, we know we're in it for a long haul, and really are going to have to continue to really do some hard work on some issues.
So thank you, Chris. What do you think are some of the challenges you're expecting in the future, and what are some of the promising opportunities out there?
So I think the challenge will include being able to maintain a lot of the protections that we have in food safety law. Recent bills have shown that that's what is going to happen. They're going to continue to chip away at those at the protections that were in place. And just like Amanda was saying, we've become it's become tough because we are the success that we've had in the past is what's led to this. And that is something that I think will continue. Food freedom, how much further can it go? And we need to, keep an eye on how much further they'll try to take food freedom. As far as positive things, I think that there'll be more of an eye on environmental health, the climate issues that we're dealing with, and a lot of the challenges that'll come from that. I think we'll put an eye on environmental health. And while that eye is on us, it'll be our opportunity to be able to expand the knowledge, educate, create opportunities for environmental health that we didn't have in the past.
Gotcha. Thank you. Justin, from your point of view, what are some of the biggest challenges, but what are some of the most promising aspects?
So I'll definitely say Illinois, I feel we're very blessed because we have a pretty robust public health system and support for public health. I think we're going to see a continuation of growth of food freedom. I think the hard part on our end is going to be funding. It's going to be having the resources to do what's being asked of us. And I know one of my mentors always refers to, food safety as a pendulum. It swings one way, and for a very long time, it swung so far one way that you couldn't even have a hot dog cart outside, because it was just food safety. And as regulations start to, relax, the pendulum is going to swing the other way. Unfortunately, I think what's going to cause the pendulum to reverse and start swinging back towards our side of food safety is going to be illnesses and death, which of course is the number one thing we don't want, and is exactly why we push against, some of these laws. And we remind our legislators that, look, food safety, the FDA code, like there's a reason all this is in place. There's a reason this has all been studied. So I think just making sure they understand our needs and fund us. That's the big thing.
Any promising notes you have out there as we close out?
I think the general public is at least able to start understanding food safety. I think there's a better understanding of what we do. That could be potentially something that we see out of the NEHA movement. Is general food safety and an understanding, that people get sick when certain things don't happen. And I hope that's, one of the things we do gain on.
Excellent. Chris, do you have any final thoughts you'd like to tell our listeners?
Yeah, the thing is, and I want to touch on climate change and how much environmental health plays such a huge role in climate emergencies and other disasters. This is an opportunity, I think, for us to make the environmental health workforce more resilient, make it stronger, create more modern training opportunities, more alternative pathways to be able to strengthen environmental health, because more of us are going to be needed. And I think that this is an opportunity for us to see that we know that these things are going to happen. We know that we need to work toward that, create those strategies to be able to do so, reach out to the colleges and universities, build a new, younger workforce and support them and bring them up so that we strengthen environmental health workforce.
Excellent. Amanda, your final thoughts from California?
Yeah, I think I would echo that. I mean, certainly, the disasters that we've seen here in California have reinforced the fact that environmental health professionals are first responders. They're often the first folks in, certainly for cleanup, but many times while the disaster is still going on. And so, it's a profession to be proud of, and we're certainly looking at ways to, as I said before, bring more people into the profession, really support the folks that are currently in it, both with more professional development training, as well as, the type of support we would provide first responders around mental health support and really helping them to cope with what they've seen. So, yeah, it's an exciting time for environmental health.
Excellent. Well, on behalf of NEHA, I want to say thank you to our three guests today for sharing with us about what your experiences have been with working with your legislature and environmental health in your state. Just a reminder that Advocacy Insights comes to you the third Thursday of every month, and we will give you an update what's going on out there regarding environmental health in the government arena. On behalf of NEHA, this is Doug Farquhar, wishing you all a good afternoon.